Okay, let's talk about early treatment and maybe the role of telemedicine.
I have several friends that have tried to do telemedicine with very dismal results. The only person that I know that can do a good job with telemedicine is Dr. Joseph Gath, who works with me, and he's a co-director of my COVID unit. He's an infectious disease doctor that is, he's very good. And what he does is he creates a series of what he calls doggy bags for the patients with azithromycin, vitamin C, all the other stuff, talks to the patient using some kind of a video platform, gets an idea of whether they are breathing difficulty. If they are doing that, he sends them straight to the hospital. So telemedicine can be used. However, we did something. We went even one step forward to that. One of the things that I told you is that we tested over 40,000 people. Well, out of those 40,000 people, we have about a 9% positivity rate. When you have 9% of 40,000, that's a lot of people that want answers. And many of them want to be seen face to face. So we created what is known as a COVID specialty clinic. So I have a clinic in own area of the hospital just for people that are positive for COVID, that has its own CAT scan, its own radiology department, laboratory testing, everything is on there. So they come in, they are seen by an internal medicine doctor that answers a lot of their questions. Should I use this? Should I get intravenous vitamin C, for example? Some people come and they have read about the math protocol and they come and ask those questions. Some people ask questions like, am I going to die? Even though they have no other symptoms and they just tested positive. So that's one of the important things. That's one of the challenges that we have.
Can you explain this in Houston? So is testing free? People can go and get free testing?
Yes, it is free, but people are reluctant to get tested. And they do so because of the stigma that you get when you get diagnosed positive for coronavirus. Very similar to the stigma that people used to have when you have HIV. We were the first ones to create a drive-through process where people go in, and that's where we have done the 40,000 people. And we've done it through a series of 5 different locations. And yes, we have been actually paying for this out of our own money. That's the hospital's own money, in hopes that the government, they say that they're going to pay for all the testing for everybody that's tested. We hope that that will be the case. If not, I will have no job in the near future. So that's what the goal is. In the United States in general, the president has been very clear that anybody that needs to be tested can be tested for free.
And once the test is done, what's the process? How is it communicated to the person? How do you get them to show up at that clinic?
Well, and that's the most difficult part. The first thing that I do when I get a positive test is I call the Department of Health in Houston. So they are the first ones that they get called. Then we call the patient. And then we tell the patient, follow up with your primary care provider. However, if you don't have a primary care provider, then we give them the number to our clinic and we arrange for them to be seen in the clinic. But one of the things that we are not doing, and we're actually going to start doing now because of lack of time and funding, is contact tracing. It's not just to tell you, you have positive COVID. We need to know who you have been in contact with so we can make sure that everybody is at least informed of what's going on. And that is a very difficult, very, very, very difficult job. And despite the fact that I have tested over 40,000 people, the city of Houston is 4 million people. So in the ideal world, everyone in the city would be tested. That would allow you to at least identify where are the hotspots where people have COVID.
And for most people will have some form of health insurance, but some people don't.
Well, actually,
how do they proceed?
That's interesting because last night I was working on that at midnight, and what I have found is that 33% of all the patients that turn positive are asymptomatic. That means they have not a single symptom. And these were people that were tested just because we keep on pushing for people to get tested, whether or not they have symptoms. And that's the most scary situation. And that's why contact tracing is extremely important, because you may have somebody that is completely asymptomatic doing normal activities and maybe spreading the wealth to everybody else.
But okay, that's substantial point. But you know, if I may ask, people who don't have health insurance in the U.S., how do they get treatment if they cannot afford it?
The government has promised that they will be paying for the expense of anybody that is admitted to the hospital with a diagnosis of COVID, whether you are insured, uninsured, legal, or illegal. So to that extent, we're lucky. And again, that's what the government has said. We don't know if that's going to happen.
Okay. But so you are admitting the patients essentially.
I mean, and you know, even if they didn't do it, I mean, I'm a doctor. I mean, we will admit them. We take care of patients without or despite insurance. That's not an issue. But you know, the cost of caring for a patient in the intensive care unit with COVID may be quite excessive.
What kind of range is it per day?
I mean, if you think that a normal intensive care unit cost is about anywhere between $5,000 and $6,000 a day, imagine that COVID is probably twice as much. From the equipment that you have to dispose, to special machines, to special treatments, even though the math protocol that we use is ridiculously cheap.